Hello, everyone. I'm so pleased to be here. Thanks to Biotone and Danelle for inviting me to make this presentation. I know that there's been a few presentations on MLD lately, so I really wanted to bring it down to the origins and the inspiration for doing MLD, because I think these are some of the things that are missed. So it's actually a practice that's approaching 100 years of since Vodder first came up with this technique. That was in the late 1920s. So let's just not go forward. You're going to have to bear with me. We've been having technical issues and I'm not quite sure what's going on with my computer. Let's try and, okay. So introduction to Emil Vodder on the right and his wife Estrid, who was a naturopath. And Estrid worked alongside Emil Vodder in their clinic in the south of France in the late 1920s and early 30s. Now, Emil Vodder is a native of Copenhagen, and his first degree was actually in art history. And it was in his studies of art history that he basically became quite fascinated with some of these drawings, copperplate drawings, in which the lymph system was actually displayed. And this was the work of Thomas Bartholin way back in the 1600s. And so what he'd done is inject gum resin and indigo into a corpse and basically making the pathways visible. And so this is the first illustration that he saw in these copper platings, and the drainage pathways of the arrows were added later. But what you see are the numerous vessels that cover the torso, and of course the legs and the arms, and the drainage areas of those vessels. So Vodder actually was in school to become a doctor, but having contracted malaria, he was actually, they made him leave. And then when he wanted to come back, when he was better, they actually wouldn't let him apply. So he went towards physical therapy. His doctorate in physiology is actually an award that he was given for the work, for his contribution.
It's been a long journey.
So about Emil Vodder, he was influenced by several physicians in the late 1800s and the work that they had done. And I think this is really significant because what they did was look at something completely different. So from the 1600s to the late 1800s, nobody really had discussed the lymphatic system. And even at this time, they didn't discuss the lymphatic system. They were actually talking about the internal milieu, meaning the fluid body. Well, we're a fluid body of approximately 70% in our prime. And basically, one of the first people who revealed the importance of this was Claude Bernard, who was the person you're looking at on the left, and a French physiologist, along with a noted physician. And he coined the phrase milieu interior. And now you have to forgive my accent here. French is not my strength. But what that means is that the milieu in which the cells bathe. And it was him that declared that this milieu was actually the most important, one of the most important aspects of our health. And so you can look at this, and this is one of his writings. He said that the fixity of the milieu supposes a perfect healing of the organism. I just need to move this. Basically, the perfection of the organism, such that the external variations are at each instant compensated for and equilibrated. meaning that whatever the body is experiencing, then the internal milieu can actually monitor that and act accordingly. Well, this would apply to our defense system, which is within this internal milieu, as well as some of our responses, inflammation, the whole thing. So all of the vital mechanisms, however varied they may be, have always one goal, and that's to maintain the uniformity of the conditions of life in the internal environment. And it's the stability of this internal environment which promotes the condition for the free and independent life. So he was looking at the cells and in the liquid in which they bathe and in which they receive their sustenance and their support. Wrote the following. And so he also wrote this, and I had to include this quote because I think it so applies to Emil Vodder. So he wrote, "The origin of an original work is always the pursuit of a fact which does not fit into accepted ideas." So why that applies to Emil Vodder is because his pursuit of the lymphatic system was a pursuit of something that basically had been ignored since the 1600s. They had seen these vessels but done absolutely nothing. And everybody was looking at the cells in the blood, but not at this fluid in which they bathe. And Vodder was looking at the fluid in which they bathe and how the transportation of that system worked, from distribution of nutrients to the picking up of metabolic wastes. So another great influencer of Emil Vodder was Alexis Carrel. And he was a French surgeon and an anatomist and a biologist. And he was a Nobel Prize winner in medicine. His experiment, which was really exciting to Vodder and to, I think, and to lots of people at the time, was basically that he did a cells in vitro experiment. And this experiment was that of him shaving the cells from the heart of a chicken fetus and laying these cells into a hydroculture medium. Well, the normal lifespan of a chicken is maybe 5 years. He kept these cells alive for 11 years. And what that demonstrated was that the life of the cell was dependent on the fluid in which they were bathing, on the hydroculture medium, or the pristineness of this fluid, the purity of this fluid. And so basically, while he, this was the experiment that was noted, and 11 years was the time that he had kept these cells alive. He didn't go home and say, okay, well, that's that. I don't need to do any more with that. He kept those cells in his laboratory. And he wrote a book in 1935 called Man the Unknown, in which he talks about these as being his immortal cells. So that was 23 years later, plus the 11 years that they've been alive. So we're looking at a lifespan of 34 years. And they were still alive, and I think they may possibly have outlived him. So again, this again was provoked the interest of Emil Vodder, because his question then became, well, how is the fluid kept so pristine? And so that was his thing to determine and to prove, actually. So if we move, this is forward. Oh, yeah, let's move forward. Sorry. This image, this is shooting forward quite a few years, just to give you a quick aspect of what happened in the gap between the time when Vodder was working in his clinic in the 30s. In 1936, he did a presentation to the medical congress in Paris. And his thesis was health for all. And his health was dependent on the lymphatic system removing the metabolic wastes. And he had spent those years in the early 30s practicing this work and seeing remarkable effects on his patients. And a lot of his patients showed up with swollen lymph nodes in the neck and congestion. And in doing this work, not only did they get to feel better, they actually got to look better. And the question that arises from their friends was, what have you been doing? Why do you look so much better? And so it became obvious that the work wasn't just a health treatment, it was also an aesthetic treatment. And we have to thank the aesthetics because they are actually the people who picked up on his thesis. And in the early years, they're the people that ran with it. Now, in 1939, when the war broke out, Second World War broke out, Vodder had to return to Copenhagen to his home. And therefore, the work in France had ceased. And after the war, he opened his clinic in Copenhagen. But he also set out again on lecture tour. Germany was where he met Professor ASTECC, and this was in the late 50s, early 60s. And Professor ASTECC was the one medical physician who actually really appreciated what Vodder's thesis was and put it forward. The image we see on the left is Dr. Vodder seated, his wife Estrid standing behind is Gunther Wittlinger and the Hildegard Wittlinger to the right. And so Emil Vodder mentored Gunther Wittlinger. Gunther Wittlinger was quite awestruck by his work. And in the early years, Hildegard tells stories of how it was an absolute struggle. But eventually, they proved their thesis. And the way they were able to prove their thesis was on edema, on swellings, because these were physically available. And so people could actually see the difference in a limb before and after treatment. So it became an approved physical therapy in the late 60s and 70s. The school actually, the Vodder School actually first opened in the 70s, and the ASTECC school opened in the 60s. Okay, so jumping forward quite a few more years, as you can see here. This is a class in which I had invited Hildegard to come and teach, and these were all my students. Basically, I had moved from the UK in 1985, and I couldn't find MLD training in the US, so I actually invited Hildegard to come over and to teach. And so that helped me get my certification. I certified in 1990 as a lymphedema therapist, CDT. But I have to say that wasn't my first love. It was certainly the certification, but my goal has always been holistic health, or as Vodder wrote, health for all. And so my real interest was in the origins of his theory and how it could be useful for numerous purposes. So moving forward, after 7 years of practice where I virtually did little else but MLD. In 1996, I returned to my holistic path, if you like, which actually turned out to be amazing, because in early 2000, the physical therapy body lobbied to have lymphedema treatments removed from reimbursement for massage therapists, saying that it should be done by lymph drainage therapists. And so a lot of therapists at that time actually lost their employment in hospitals where they were working, or lymphedema clinics, or in burn units, because it's, as you're going to see from some following slides, it's incredibly useful on burns, or very effective. Let me see what else. So basically, moving forward, then we start looking at some of the case histories that have been done, not on lymphedema, but on other conditions that we see. So let's look at it. So fast forward again. So now we come to looking at the practice, an overview of the history, and now the practice. This is one of the slides that I was shown in my training that actually got me enthralled. And this was obviously a burn patient from the Vodder clinic in Austria. And basically, you can see the improvement is quite dramatic. And this is in just a few weeks of treatment. So that kind of had me fascinated, because up until this point, I had been utilizing really trigger point therapy based on the work of Janet Travell, and also traditional massage techniques, neuromuscular work. And so this was sort of a revelation that this kind of thing could be treated by touch therapy. This is one of my burn patients. So this was a two-year-old who had a terrible situation by, she pulled a cup of boiling water onto her she'd reached up onto a kitchen counter, and this water poured all over, and you can see she had really bad burns on her face and on her chest. And so my treatment of her was to work on her every day where I could, for 5 days continuously. And then on the 6th day, she got a bit restless. On the 7th day, she was more restless. On the 8th day, she's like, I've had enough. But basically, so we moved her treatments to twice a week after that. In a couple of areas, the degrees were close, 3rd degree burns, but as we move forward, we actually see that this is my this is her 3rd birthday, so this is a few months later, and this is a video, and as she turns her head, you can see. So she doesn't have one scar, and everything is really, really great. So moving from burn patient to cosmetic surgery. And I have to say, I absolutely love doing this work, because you get such great results so quickly. So first and foremost, this is a 60-year-old client of mine who had determined she was going to have a facelift at some point in her life, and decided that by the time she reached 60, she better do it then, and rather than later. And so she had a full facelift, which means she had the neck and full face and the forehead, and a full lid lift. And she also had some fat removed from under the jaw with liposuction. And she had some injections to fillers around the lip to remove the small lines that she had. To be honest, when I saw her before her surgery, because I always treat at least 3 times before the surgery because we want to make sure that the fluid is as pristine as possible, that reduces the risk of infection. And also, if anything is lurking in the tissues, such as a pathogen, then it would be obvious within the first treatment. And so we would have time for that to move through before the surgery. So see her at least a week before the surgery. And then the second picture is actually on the 3rd day. And then it goes on to the 4th day. On the 5th day, she had the stitches removed. And that actually proved to be a terrible thing because, well, for me, because I had been very effectively draining the tissue. And basically, when they removed the stitches, her inflammation came right back up, and what looked like the beginning of an infection behind the ear was starting, and I had not seen any sign of that before. So this sort of proved an interesting challenge for me. Anyway, we proceeded to treat with caution in this area, but more extreme in the other side and things like that. The picture on the right is actually the 9th day of treatment, and the stitches have healed beautifully. The scar behind the ear, or the wound behind the ear, had healed beautifully. And there's very little notice of anything around the ear. And you can see the swelling is way down. So I just did a class in New York in which we had a student who actually been to Turkey for a facelift, and that had been 3 weeks prior, and she had way more swelling and way more, in need of treatment, way more in need of treatment than this patient at 9 days. In fact, the staples come out on the 10th day, and that's when we release them. It's when I release my patients because they're completely better. So the thing about manual lymph drainage is you can see from the 2 case histories that I've presented that it isn't just, I'll see you in next week for treatment, or I'll see you in 3 or 4 days for treatment. When it comes to actually treating, the more frequently we see people, the greater the effect we can have. So with this client, I started in the recovery room, and you must be looking at this and wondering what on earth could I do? I treated her in the recovery room, just treating neck and shoulders and opening up the terminus, the main drain point, which is at the junction of the subclavian and jugular vein. And I just did that for 25 minutes. That was all I could do. I left her. When I got to see her the next day, she looked absolutely wonderful. The bandage was off after 24 hours, and she had no pain. And I think that's perhaps one of the most powerful things when we start working with people, and it really doesn't matter what surgery, I'm going to say, we always get an immediate reduction of pain after one treatment. And patients describe it as if it's like lapping waves, just washing over them. They fall asleep, and then after they have fallen asleep, they wake up and the pain has gone. And I've done this with chin implants, with breast augmentation, with numerous surgeries, and seen great results. I also treat menstrual pain in this way, just to treat for usually about 30-35 minutes, enough to trigger the mechanoreceptors, which are the touch receptors, which then override the pain receptors, and which shut off the pain. And the pain is just gone for the rest of the menstrual cycle. So just looking at the variety of treatments, this is another burn treatment after 3 weeks of treatment. The healing pretty dramatic there, really. And we'll go on with this is one of my favorite case histories. This young lady, she can see very hard, very much so, that she's trying to get that right eye open as she's taking a selfie. So these are the 2 pictures that I received, asking if I thought I could help her. She had driven her car off the road into a mailbox while she was trying to retrieve something from the floor, and the right side of her face was severely bruised, as you can see. I mean, just look at the swelling over that eye on the picture on the right. And so as I proceeded to work with her, we started again on a daily basis. And this is probably after about 4 or 5 days, you can see she actually did get bruising under the left eye as well. So she had a black eye here as well as a right eye. But of course, this was the one that was damaged, and you can see the damage much more extensive there. And she ended up with what was a cross between a seroma and a hematoma. This was really hard. The fluid was really trapped in this. And I'll be honest, at this point, I didn't know that I could reduce it or whether it might need aspiration. Basically, we kept working, and we were very effective, because as you see here, this is how we end up. And this would be on the 7th day of treatment. And I treat for approximately an hour each session. One of the things was that I was going out of town from here on, so I was really pleased to have her looking like this on the 7th day. What I did do, there was still a tiny bit of discoloration. I left her taped. So I don't know that you can see it very clearly, but on the left side of her face is kinesio tape. And so I taped her face so that it would continue the drainage. And I was going out of town to teach a class, and I told her I'd see her when I got back. When I got back, I didn't need to see her. Everything was absolutely clear. One of the benefits of this is, I don't know whether you noticed at the beginning, but her skin was really quite bad around the jawline and the chin. And so the secondary effect of this was that we cleared her skin. So one of the things that we also do is basically we help acne. So I treat acne and rosacea, and apart from hematomas and things like that. So skin conditions respond remarkably well. And a dry skin even responds remarkably well. I had, this was from a class that we were in California, and a student came in and she said, I completely forgot to put moisturizer on because she didn't feel the dryness in her skin that she normally felt every morning. So one of the things about manual lymph drainage is that Vodder always called it the great normalizer. And it's the same as Claude Bernard was saying. If we can have that fixity of the internal milieu, then what we have is a normalization of the tissues. So the great normalizer. So actually so MLD, as you can see, expanded my practice tremendously, not just into lymphedema and lipedema, but into everyday situations, whether it's an accident, whether it's a sports injury. This actually was a sports injury. This guy had been playing flag football and had actually torn his fifth metatarsal ligament. And so basically, the doctor had said, well, in time it would heal, but if he wanted to keep playing sports, then he should have surgery. He had his surgery, and 7 days after surgery, he was meant to have the stitches out. But when he went to have the stitches removed, his foot was so edematous that the doctor said, there's no way I can take these stitches out right now. Go home, rest, put your leg up and get that swelling down. Well, that's when it called me, because somebody he knew referred me to him. And we began treatment of the surrounding area. The concern was the one tissue area that looked as though it was beginning to go necrotic, or could become necrotic. So that was an area that I was focused on. Anyway, as we move forward, and this is oh no, lost it. Sorry, somewhere I should have the corrected where we see the end of that. And maybe I can find it at the end of the presentation, or maybe it's in the wrong place and we'll come back to it. You're now looking at a liposuction patient or client. So you can see the marking where the cannula went in, and you can see the bruising that ensued. Now, she had liposuction to this area on the back of her sacrum, but also to her abdomen and to her thighs. She was not an overweight patient. She just she was in her 60s, and she just wanted to remove those stubborn bits of fat that exercise didn't seem to be affecting. So this is after probably about 4 days of treatment. And what I didn't do is document this so terribly well, because I'm jumping over different areas of the body. But you can see the legs here. And actually the legs cleared incredibly quickly. You know, when somebody has liposuction, they're told to keep their garments on, but I would go and see her every day at the time after she took her shower, and then she'd replace her garments. And my treatment protocol is literally 10 days. So it's a 10-day protocol, and working the tissues. This was probably only 5 days it took to clear that. And I wished I'd photographed her abdomen, because that was the main area that she wanted done. But here she is 10 days later, and she looks great, and there's hardly anything to see, and the tissue was soft. And if you look on the right-hand side, you'll see a woman who'd had liposuction just over 3 weeks previously, and she was in terrible discomfort. She was still wearing the garment, and she could hardly bend over, and she was really in a lot of pain when she came to see me. And so the sooner I get to a patient, the greater the results, and the more their comfort is delivered very quickly. This is the foot. So I treated the foot for the one with the surgery for the fifth tarsal ligament. So basically I treated him, and this is how he ended up. There may be another slide. Let's wait and see. But this was pretty good. I left him to bathe in salt water because, again, I was going out of town to teach. The great thing about manual lymph drainage is that you do this series and you can actually work it around a schedule. Well, I could work it around my schedule, so it was wonderful. Yes, there's the other picture. This is how he looked the day before he went in to have his stitches out. All the edema has completely gone. You can see the skin is a little dry. That's normal with edema. Again, it's because the fluid exchanges have not been made correctly. But this is looking really healthy, like healthy tissue. And then again, when the stitches come out, a little bit of edema reoccurred, but on the whole, the skin looks really good. And so his healing was hastened with the use of MLD. So, as a manual lymph drainage therapist, looking at the body from a holistic perspective, and Vodder always considered the body from a holistic perspective. What do I see my task as is to actually maintain as much as possible the equilibrium of that internal fluid, which we refer to as our internal ocean. And so we've learned a lot about the blood, and we learned quite a lot about the lymph vessels, but it's actually everything plays out in the loose connective tissue between the blood and the lymph is what's going to pick up the waste and metabolic waste and excess proteins and pathogens and move them forward and deal with them and remove from our body, only returning cleansed lymph to the blood. So I've been and so basically that brings me to the summary and to just right on schedule, I think, for our 40 minutes. Basically, I feel that this has delivered a great sense of purpose to my practice. I've gone on to develop a treatment in which we're looking at the drainage effectively from head and neck to help improve with memory loss, with depression, with anxiety. If I look at the diseases of modern society, manual lymph drainage has a great effect on most of them. Fibromyalgia, all of the autoimmune illnesses are given some relief with MLD. I'm not going to say it's a complete cure. I'm just going to say it relieves a great deal of the pain that people are in. I think that's it. Okay.
Okay. Well, I'm going to jump in. We had quite a few chats come in, and I wanted to let folks know that Anne has been practicing since 1978 as a certified Dr. Vodder School instructor. And Helen, that will answer your question, which was what MLD technique do you use, Vodder or Chickley? And since 1978, Anne has been certified with the Dr. Vodder School as an instructor. She also founded ASTECC, Advanced Spa Therapy Education and Curriculum, in 1995. And I wanted to mention that she authored Cortiva Spa Curriculum, and in 2019 won American Spa's Educator of the Year. So she has quite a expansive history here with manual lymphatic drainage. I don't know where everyone just went, but I'll continue. We do have some chats, Anne, that I'd like to um, get your feedback on. Britt Britt was asking, will there be any demonstrations or techniques about MLD that you showed tonight? And um, we really didn't cover that. Um, so I want to hold on to that to further towards the end of our talk. Um, Now Jason is asking, and this goes back to the first set of slides that you showed, how many days from young girl's burn until the first treatment? And then he's saying the same question for the 60-year-old surgery patient, the facelift. Did we lose Anne? Well, not that I can answer these questions. Let's just hope she just jumps back on. She was having technical difficulties earlier. But I did see some chats that I think we can address. How many days before plastic surgery they have to do lymphatic drainage? And what I remember from Anne's talk tonight is she said she met with the woman 3 times before she had the facelift procedure, and someone else had chatted. It was they heard a week, so I would use that as a guideline, a week, and at least minimum 3 treatments. Um, let's see. I don't know how to answer the next question, Jason, about charging or assisting patients in insurance reimbursement. We'll have to, hopefully Anne will get back on. And how many, all these questions I am not qualified to answer. How many days after surgery you started lymphatic drainage? After surgery, it sounded like within a couple of days, a day or two, 48 hours, 24 hours. But again, hopefully she'll get back on and we can answer these questions. Okay. May I attempt to answer? Yes. Sarmita, um, if you can unmute yourself, that would be great. There you are.
Hello, I am not
Hi.
Bramham, but I am a big fan of hers and also a Dr. Vodder School certified therapist since 1991. And just briefly to answer the questions again, it's all about technique and where we put our hands. And one can see the patient immediately post-op and went to see the patient in recovery. So the key here is that we do not necessarily place our hands on the incisional sites, but those areas which those sites can drain toward, that is where we can work the tissue. The lymphatic system is a connected system, so therefore, if you work especially the terminal areas or the terminus areas, this is very important because this is where everything flows towards at the end of the lymphatic system. But again, you may be within your context of practice and your rules of practice for your state. You have to understand your own limitations and your comfort with your patient, especially if they have wounds, incisions, drains, and so on. But myself as a physical therapist, we have definitely worked immediately post-operatively. Prior to surgery, what Anne mentioned, I respect what she had mentioned. I really appreciate the fact she said approximately 3 treatments within the week prior to surgery. And I will also attempt to see my patients prior to surgery. They really feel good. The surgeons often will give feedback that this is very effective in terms of how they present during surgery and also post-operatively. So I hope that helps answer some of those questions.
Well, thank you. And there are more questions if you're willing to let me read a few more to you. Regarding the burns, any specific topicals used on burn patients?
That one is a little more difficult for me to answer as I'm not treating burns at this time. But again, in consulting with the wound care specialist, there may be some recommended items that are preferred, especially in today's updates of items that are best for the tissues. Again, we in general settings, we would have to consult with the surgeon and their preferences. However, from an MLD standpoint, from a manual lymph drainage therapy standpoint, again, we can work proximal to those burn sites, meaning in the areas of where you want that lymphatic vessel system to drain from that incisional site or from that burned graft site or from the burn itself site. Again, if you're concerned of any nature, it is not necessary to place one's hands on the affected site. Proximal to that site, if you've learned the anatomy, is very effective. And you remember Anne saying that she worked maybe 25 to 35 minutes, oftentimes with these individuals, and made a great bit of difference regarding pain management, deep relaxation, which is a big part of properly executed manual lymph drainage therapy because of the rhythmical nature of how we provide the therapy and the light touch, and also the effects of drainage due to the lymphatic therapy drainage that occurs through the vessel system.
All right. And I had Susan asking, aside from specific topicals, can MLD alone be combined with other therapies such as aromatherapy?
Yes, there are several practitioners that will combine their therapies with aromatherapy. These are gifts that you have as therapists, be it whatever your backgrounds may be. Again, respecting the tissue integrity is really key, right? Because if there is something like an incision, we really want to respect the integrity of that incision. So clean hands, clean environment, your comfort zone, your experience with that region. But again, remember the terminal points. Just doing breath work, which is a huge part of what we teach our patients and learn as a Dr. Vodder School lymphatic therapist, is how to do proper abdominal breath work and breathing. That is a lymphatic pump. And then therefore your aromatherapy becomes even more important because your system can inhale and appreciate the aroma aspects of the aromatherapy. So yes, applying aromatherapy or at least having it available in the space may be of great benefit to your clients and patients, especially if you are an aromatherapist who knows and understands the benefits. So do know your precautions and any contraindications and so on and so forth regarding any other modalities that you would wish to use in your wheelhouse, in your and definitely apply those. MLD in itself is extremely powerful, especially when done properly. It moves more lymph than you really understand or recognize until you do it. And when you do it properly, you'll be amazed by the results.
All right. Anne is trying to get on, and I'm just sending her the code. So my apologies for being off screen. Okay.
I think she's there.
Crazy.
Yeah, I think Anne is there. She just has to be unmuted.
Okay. And Anne, you need to unmute yourself.
Yeah, done it.
Okay.
I don't know.
Sarmita jumped in and helped, and as I fumbled over trying to recount some of your talk, but someone wanted to know if there will be demonstrations or techniques, and I want to hold on to that till a little bit later. And Jason had asked, and again, just we went over some of these, but how many days from young girls' burn until the first treatment? And same with a 60-year-old facelift.
Well,
Did you
60-year-old
jump in?
face. Let
Was
me
it
take
within?
the thing is, as soon as possible. So the 60-year-old facelift, I treated in the recovery room. So that first picture of it in the recovery room was when I was treating. So basically, I was working right there. So I worked with a plastic surgeon who was very open-minded and let me get to his patients straight away, which was great.
All right. And Jason also asked, do you charge or assist patients in insurance reimbursement, or do you operate a client cash practice?
I operate pay me now because one year, this is when I was really doing a lot of lymphedema. I lost a lot of money by trying to get insurance reimbursement because I was spending so many hours to do the insurance that basically I was losing money by not working. And at that point, I just like, I really didn't want to employ somebody just to do insurance because again, it's not my thing. And basically it's cash basis, absolutely. And so obviously I take credit cards, and if people are buying a series, that's the way they can pay. And we also do payment plans as well. So
Okay.
I work
So the
with
series,
people as much as possible. Okay.
the series is an interesting concept for people to, incorporate into their practice. As
Yeah,
opposed to having one-off treatments, because it's what I heard you say during the talk is you'd see them for 10 days, or you'd see them for a period of time. So that would be good to package it. Correct?
well, that's what I did. I packaged it, but I have to say that I also I retained also a clientele who came back time and time again. You see, one of the things that I didn't even get to into the talk is how it helps joint mobility. It helps pain. I'd love to tell the story of one of my favorite case histories, which took me to 5 days of treatment on an elderly gentleman. When I say elderly gentleman, he's about the age I am now. But at the time, he was elderly to me. Anyway, long story short, he had a sports injury. And I went for that sports injury, and I used first my original training of trigger point, etc., thinking that would be the best. Didn't get the results I wanted, so said, I'm changing your treatment. I need to see you every day. By the end of the treatment, he was so impressed with all the other effects he'd got, like improved respiration, improved sleep, improved digestion, and low blood pressure. He became a client on a regular basis because he found it so valuable. And also it kept him mobile as well. So I think it's an absolute must for elderly patients. We do lots of joint mobilization work with manual lymph drainage. And really, I don't know, it's just good. It's just completely changed my practice. Yes, I see people because I want to have the effect. So seeing them once a week or once every fortnight isn't going to be tremendously effective if I'm treating a condition.
All right. And Susan asked about the auto accident gal, and was that a hematoma?
So it was a hematoma. It was a very bad hematoma, but it also seemed to have seroma qualities too, in as much as it was so hard and it was solid. It wasn't soft tissue. A hematoma stays soft, but this was absolutely solid. So we thought it might need to be aspirated, but MLD worked wonderfully. And I've since treated sports injuries with similar effects. So yeah.
All right.
Can I just say one thing?
Yes,
My
please.
son was an avid basketball player, and he was also really good at getting injured on the court, and he was one of my best patients. What can I say? But the reality is that he never understood why I wasn't working for a team. It's like, why aren't you working for a professional team? It's like, it's not my goal.
Right. But somebody interested in sports massage, and
Yeah.
that could be a good opportunity and another modality technique to have in their toolkit,
Well,
let's say.
the whole thing is it treats so many things. I mean, it just completely expanded my practice.
All right. Well, Britt, at the very start, asked, will there be any demonstrations or techniques about MLD? And I don't know if there is anything you can share to that topic.
I think if you go to my website, you might find a couple of things on there, but certainly over time, we've sort of posted images
Okay.
of MLD being done, but you must know it's a light rhythmic technique. There's no pressure, heavy pressure involved in manual lymph drainage.
All right. Let's see. I think we covered, how many days after surgery do you start? And
Straight away.
Sarmita was very helpful in answering questions when we lost you for a while.
Oh, well, good. Well
Yeah.
done. Well done.
Yeah, so I had in my notes that some of the benefits to MLD are the autoimmune health, digestion, brain function, and skin conditions. And you also mentioned joints.
Well, absolutely. But one of the things I just want to say is if you look at the effects, what we truly affect is the autonomic nervous system. And so it's the effect on the autonomic nervous system that affects respiration, digestion, sleep, things like that, because those are all under the influence of the parasympathetic nervous system. And we shut down the sympathetic nervous system, which is why we're so effective on anxiety and stress. And quite honestly, 90% of, this is not my numbers, these are the medical figures, 90% of modern disease is caused by stress. I say this in my classes all the time. We can have the 90%, we'll give the doctors the 10%.
Would you be able to tell us your website, please? Meryl would like to know the website.
It's ASTECC.com. So it's ASTECC.com.
Okay.
I just
www.astecc.com. Okay, I just put it in chats. Many of you are new to the EduTalk series, and those not familiar and just joining us tonight for the first time, thank you. But also, the day after the EduTalk, you will receive a follow-up email, and in the email, it will include a recording link so you can rewatch this. It will include Anne's contact information and any handout that any of the presenters choose to include. Often the emails go into spam or junk. So please, if you don't see a follow-up email by midday, please check your junk or spam folder. Thank you. And did you teach refluxology?
Yes, is the answer. I did. Yes.
Okay. And
we all must have been there, right? Yeah.
People are saying thank you for the visualizations and topics, the case histories, and the pictures and the information. I'm not sure if you have anything you'd like to add in closing, anything about any 2026 classes you may have coming up.
Yeah, absolutely. You'll see if you go to our ASTECC website, you'll find classes posted there. And we teach neck and face and full body, clinical wellness, fluid connection. I mean, basically all of these are based around manual lymph drainage. So yeah, I mean, one of the things I will say is that I just need to correct something you said. You said I've been a qualified therapist since 1978, but not a lymph drainage therapist. That was
certified with Dr.
my whole career as a massage therapist. I actually, which just lets you all know how old I am. But basically, I started my lymph drainage career in 87, 88 when I was bringing Hildegard here. I had learnt another method. And what I learned is I learned the wrong method, and that's all I'm saying about that. But yeah, I started in 87, 88. It took I didn't go to certify as a lymphedema therapist straight away because it wasn't where my end goal was. But then when I did it, I did nothing else for 7 years. So
Okay, thank you for clarifying that. Um, oh my goodness, are you hiring educators?
only if I've
And
educated them.
well, there you go. I think that's inspiration and motivation for folks. Sarmita is saying she's a big fan of yours, and this is code to me, DVSI certified in 1997.
Dr.
I
Vodder
still
School,
do
yeah. Dr. Vodder
DVSI
School,
reviews under Kathy Fleming, PT,
yeah.
CLT, and Dash Lana, who was in the photo with you.
Yes, she was.
So,
She was becoming a CDD. She was there to assist Hildegard in one of her final um, moves to getting her CDT teacher certification. So yeah, Kathy's a great girl. She's actually the only teacher with the Dr. Vodder School now in North America. Actually, they may just have introduced a couple more. Take that back. Sorry.
okay, when I read the upcoming Edu Talks, I'd love you to read the last chat that just came in, please.
Okay.
Okay. Again, we have a final Edu Talk of the year, December 16th, and it will be with Dr. Susan Salvo. She will be presenting on updates for C-section recovery, postpartum depression, and infant massage. And that will be next Tuesday. And then we will pick up the EduTalk series again, both the EduTalk Massage series and the EduTalk Diabetes series in January 2026, which is crazy to think how time flies. January 13th will be the first EduTalk of the year with Nathan Nordstrom, and he will be presenting Add Tools to Your Practice for Client Satisfaction, Self-Care, and Career Sustainability. Our first diabetes talk of the year will be January 20th with Linda Lockett Brown, a dietitian, and she'll be presenting on the MIND diet, reduce your risk of dementia. And this is actually a very interesting topic because in August, in the EduTalk Diabetes series, we had a presentation on dementia as type 3 diabetes. All of our EduTalks have been recorded. The massage, there's over 5 years of recorded EduTalks in the archive library on biotone.com. In the navigation bar under the EduTalk tab, you can find the massage RSVP page. You can find the EduTalk archive library. And Anne did a presentation with Dale Alexander last December. So you may want to look at that. There's also numerous EduTalks on lymphatic drainage from different educators. And we also have on biotone.com under the EduTalk tab, the EduTalk Diabetes series, and that archive library is there. I would say take a look at the August EduTalk on type 3 diabetes and dementia, and it will make sense going into the January 20th EduTalk on the MIND diet and reducing your risk of dementia. Let's see. Thank you for reminding everyone about the origins and the high quality of Dr. Vodder School techniques. I still feel that the best hands-on techniques to learn due to precision and therapeutic touch and skin stretch technique. Do consider getting trained. And Sarmita included the website for Dr. Vodder School, www.vodderschool.com. And are we getting notifications on the emails on all the upcoming events? Yes, you will receive upcoming invitations to upcoming EduTalks. And in fact, if you visit the EduTalk tab on the Bioton site, the RSVP links are there, and you can sign up early as soon as they're posted. Oh my goodness, what a talk. Technical difficulties aside,
All right.
thank you everyone for being part of it. Thank you for what you do. May you have a wonderful and safe end to 2025. Visit the EduTalk library and join us again in 2026. If there are any topics that you would like the EduTalk series to cover, please feel free to email me that. And again, watch your inbox tomorrow. Thank you so much, Anne. Too many thank yous to read to you, so I hope you got a chance to read some
I
of
got those too,
them
yeah.
as well. And
Thank you, Danelle, for inviting me. I appreciate it.
thank you for all you do, and thank you everyone for all you do. Be safe and be well. Take care. Thank you.
Bye-bye. Thank you.